Hello and welcome. This is a tutorial on how to spot misinformation COVID-19 edition from the Red Rocks Community College Library. In this tutorial, we're going to learn how to get the most up-to-date and reliable information on COVID-19. First, let's start with the basics. According to the information from the Medline database, the coronavirus disease 2019, or COVID-19, is a new type of coronavirus. It causes respiratory illnesses in people. It was first identified in Wuhan, China. On March 11, 2020, the director of the World Health Organization, also known as WHO, declared COVID-19 to be a pandemic. COVID-19 can cause respiratory illness that ranges from mild to severe or even deadly. The symptoms usually start between 2 to 14 days after you've been infected, but it is possible to transmit the virus before symptoms have even appeared. This is called being asymptomatic. COVID-19 can spread from person to person. This usually happens through respiratory droplets when someone with the virus coughs or sneezes, and then you breathe it in. Most often, you need to be close to the person, within 6 feet, in order to spread it this way. It might be possible to get COVID-19 by touching a surface or object that has the virus on it, and then touching your own mouth, nose, or eyes. In the news, you may have seen COVID-19 and SARS-CoV-2. So let's talk about what they are and what the differences are. According to the World Health Organization, the name for the disease people experience is the coronavirus or COVID-19, but the virus itself is severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. Another example of a virus and a disease that it causes is AIDS and HIV. Viruses are assigned names based on their genetic structure and is put into a specific taxonomy. Using the virus's structure, it helps researchers in developing tests, vaccines, and medicines. Diseases are named by the WHO and are then in the International Classification of Diseases. The disease is given a specific name that will enable discussion on the disease, its prevention, spread, transmittability, severity, and treatment. On February 11, 2020, severe acute respiratory syndrome coronavirus 2, aka SARS-CoV-2, was announced as the official name of the new virus. Its name is based on its genetic similarity to the coronavirus responsible for the SARS outbreak of 2003. However, while genetically related, the two viruses are different. You may be wondering why the virus's name is not usually used when talking about coronavirus. It is in partly to avoid unnecessary fear for those populations that were greatly impacted by the 2003 SARS outbreak. In the news, you may also be hearing terms thrown around such as epidemic and pandemic. These are two different terms, so let's talk about them. First of all, epidemiology is the branch of medicine that deals with the incidence, distribution, and possible control of diseases and other factors relating to health. An epidemic is a disease widely occurring in a community at a particular time. A pandemic is different. A pandemic is a disease that's prevalent over an entire country or the world. So in relating to COVID-19, it started as an epidemic when it was localized and identified in Wuhan, China. Once it spread to different communities and countries, that's when it became a pandemic. Now, where to find the best information on COVID-19? The best information is going to be released from the CDC, otherwise known as the Centers for Disease Control and Prevention. Here are 3 main websites to go to when you're on the CDC website. They have a list of confirmed and presumptive US cases. They have a list of all locations in the world with confirmed cases of COVID, and then the World Health Organization uploads daily situation reports. Another way to get the best information on COVID-19 is looking at local news stations, their news sites, and national stations. Listed below are the ones that we recommend. Now also remember to critically think about the information that's being presented on these news sites and newspapers and whether the news is being presented as facts and figures as it should be, or if it's presented with bias and emotion. There are other ways to get great information on COVID-19, and this is through your own library databases. Right here we have a list of 3 library databases that we suggest using that you can get access through the library website at rrcc.edu. You could also use Google Scholar at scholar.google.com. Now this is how you get access to those databases from home. The first thing you have to do is go to library.rrcc.edu, and in the middle of the home page, you'll see a search bar that looks like this. Now click on the Articles tab, and then you'll see a link that says List of Databases by Subject. Go ahead and click on that, and it'll bring you to here. Now you see under Databases by Subject, there's a whole list of different subjects. If you click on Health and Medical Sciences, this will turn into a drop-down menu and show you all the health and medical sciences databases you have access to. You'll see a full list, but here are the ones that we talked about: Access Medicine, Medline, and Consumer Health Complete. Remember, when you're trying to sign into these, a pop-up may come up asking for your S number and your password for off-campus access. So if this doesn't happen, you may not get access, so make sure your pop-up blocker is off. Here are some more links that actually help combat COVID-19 misinformation. There's an actual statistics site that has live stats on COVID-19 in the US and other countries. To get access to this is ncov2019.live, and this is what the website looks like. Another one is InfoDocket. You go to www.infodocket.com. It looks like this. This is actually a library journal. You can go to search the site here and type in coronavirus, and it will give you all the up-to-date information that's been published. The next one is LitCovid. LitCovid is actually a website run by the National Library of Medicine, and this is a long URL, so you don't have to type this in, but if you just Google LitCovid, it will be the first link in the search results, and it should look like this. This is essentially a free library database on anything that's been published about COVID-19. And the last one is newslit.org/coronavirus. You go here, this is a website run by the News Literacy Project. Not only does it have great information on COVID-19, but it gives you additional resources on how to debunk misinformation related to COVID-19. And here again is the list of websites: the ncov2019.live, www.infodocket.com, and then the LitCovid link, and www.newslit.org/coronavirus. And a lot of our information we actually get from social media. So a great way to make sure the information we see on Facebook, Instagram, Twitter is actually correct is going to fact-checking websites and making sure those claims are true. Fact-checking websites are websites that check factual information in order to determine the credibility and correctness of factual statements on the web. They should use neutral wording, unbiased sources, and reliable links. So we have a full list for you. Some fact-checking websites to be used are AllSides, factcheck.org, Media Matters for America, Newsbusters, OpenSecrets.org, PolitiFact, ProPublica, Snopes, Sunlight Foundation, and lastly, the fact checker from the Washington Post. So if you want to get access to all of these, you can actually go to our research guide that we've made for you guys. To get access to that is rrcc.libguides.com/information-literacy. When you go to that site, it's going to look a little something like this. If you notice that second tab that says the 4 moves, if you click on that and scroll down, we actually have the list of websites available for you with all the direct links, so you don't have to go searching for them. Going back to that main site, if you go to the 4th tab that says COVID-19 information, it will actually provide you with all the information here that we discussed in the tutorial today. So that was the tutorial on how to spot misinformation, COVID-19 edition. For more information on the library and our services and resources, check us out at library.rrcc.edu. For more information on COVID-19, visit any of the websites we discussed in this tutorial or www.coronavirus.gov.